Heart disease is among the most serious health concerns of Filipinos, and this is Heart Month, and we talk about the most common heart disease and how can we better take care of our heart. So joining us today to tell us more about this is Dr. Gerardo Manzo, Deputy Executive Director for Medical Services at the Philippine Heart Center. Good morning, Doc. Thank you so much for being with us.
Thank you.
And welcome to New Day. Okay, so we'll get straight to it. What are the most common heart disease?
The most common heart disease is where we talk about heart attack. And that's when you have chest pain and you need to be brought to the emergency room. You might need to have immediate therapy, and then where surgery is needed, bypass surgery is what we often hear about when we talk about heart diseases.
Ilan ba sila? How many cases or types of heart diseases are there?
Well, there are many. There are hundreds of them. We usually divide it to congenital heart diseases and acquired heart diseases. The heart attack is an acquired heart disease.
Okay.
We have rheumatic heart diseases, which are infectious in origin. And of course, the unpreventable congenital heart diseases that we have a lot of here in the Philippines.
Okay, let's go back to the acquired heart disease. That seems to be the more common one.
Yep.
Is that correct? When you say acquired, how do we acquire it?
Usually, it is related to less than healthy lifestyles. So if you don't take good care of your heart, better diets, exercise,
Okay,
then
so
you get...
diet, and our diet should consist of?
You can eat anything in moderation,
Okay.
but you want to reduce fats and salt.
Okay, so that one, fats and salt, and exercise regularly.
Exercise.
Not excessive? I mean, because we hear a lot of people that, have heart attacks during,
Exactly.
extreme cases.
So not in excess.
Not in excess. Okay, like mga Ironman, we hear a lot of that. or-
Only if you're trained for it, but if you're the regular Filipino, then brisk walking, regular exercise will
Okay,
be
so
fine.
we have diet, exercise, anything else that we can do? Medicines or...
Where necessary,
Yeah.
then you have to take your medicines conscientiously. Stop smoking.
Okay, stop smoking.
Yep.
Okay, and not only that, but at what age do we normally see heart attacks happen, and when must I start to be concerned about it enough to have myself checked?
That's a big problem for us right now, because we usually get the heart attacks in more elderly patients,
Yes,
60,
yes.
70 years old. Now we're doing a lot of cases that are 40, maybe even less. Really a sign of how we are not
Taking
taking
care
very
of
good of our heart.
Okay, so how young must we start be concerned about this? I mean, at 30? I mean, is that too young or?
No, we actually need to be very mindful of this even when we raise our own children. So obesity is one reason why heart diseases strike when you get older. So we have to be mindful even in the younger age groups.
Okay, so it's something that we should definitely think about. And you are celebrating the 45th anniversary.
Yes, we are.
So tell us more about that, the activities that you will be having.
So we're in the middle of it. We've just passed the main events, so to say. The Heart Center was inaugurated in February 14 of 1975. So this is our 45th anniversary. We just recently had our grand homecoming. We also have the traditional recognition of our employees in a praise exactly on February 14. So for us in the leadership, we have to forego our Valentine's Day
Oh no! Well,
to make Valentine's special for our staff.
Well, definitely, it's definitely Heart's Day for you. And I wanted to ask you something about, you have this minimally invasive cardiac surgery education. Tell us
Well,
about
one of the things that we have been doing in the Heart Center really is to train cardiac specialists for both basic cardiac specialties and for advanced technologies. Just recently, we inaugurated the entire 5th floor. It was a very generous donation by our friends from the Children's Heart Foundation. And one of our partners also allowed us to install 6 of the top-end, what we call towers for videoscopic surgery. This is the biggest in the entire Asia. So we have 6 of these Einsteins, and we do minimally invasive cardiac surgery. We are positioning ourselves to be the hub for training in Asia for minimally invasive cardiac surgery.
Wow, I mean, that is amazing. I can't even begin to fathom minimally invasive heart surgery, because when you know heart, I mean, it's like, they really cut you open.
Yep. So now it becomes a small 2 to 4 centimeter incision on the right side of your chest or on the left side of your chest, depending on where we go.
So would you say, like, even something like heart disease can be avoided if detected early, and if we do avail of, of the surgeries, all the latest techniques that is available to us?
It should be preventable, but where it is not preventable, then there are now options to do it non-surgically. So as we know, stentings and angioplasties are for less invasive procedures. Now we're going into less invasive surgery. It's still surgery for patients who cannot do without surgery, but now we have smaller incisions, which means a shorter time of confinement for the patient. Initially, right now, while we're in the learning curve, learning how to do it properly, the procedure might take a little longer, but in due time, it will reduce the procedure time for maybe about half of what we usually do in open heart surgery. So it is more than just cosmesis for a patient. If we reduce the number of days the patients stay, then we can admit more patients who can be taken care of.
That's right. And not only that, but President Duterte issued an executive order setting a price cap on certain drugs and medicine. Gaano kalaking tulong ba ito sa mga may sakit?
Heart diseases is a chronic disease. You're expected to live a long life even if you are sick. And therefore, medical therapy is very, very important. So making sure that there is a rational, cheap supply of these chronic medicines for chronic diseases is very, very important. We are expected to take care of our patients for long periods of time, and the medicines are usually the mainstay of treatment for these patients.
Right. Well, thank you so much for being with us today, for bringing to light the most important part of our body, our hearts.
Yep.
Thank you so much for being with us, Doc. Philippine Heart Center Deputy Executive Director for Medical Services, Dr. Gerardo Manzo. Thank you.
Thank you.